These images show the same hoof over the course of 15 months using different trimming and shoeing methods. In A, a standard metal shoe was used. In B, a natural balance shoe was used. In C, the hoof was barefoot, and in D, the hoof was shod with a plastic shoe. Along with trimming and shoeing, changes to the hoof occurred from the effects of weather, the ground surfaces, and how the horse was ridden. Here is a morph showing the change in this same hoof over the course of 15 months. This leads us to ask the question, if the hoof shape can change so much, how can we trim based on landmarks of the sole, frog, and white line? We trim at the bottom of the hoof, but if we do so by only looking at the bottom, we may be following flares or other distortions. In the bone-referenced trim, we try to trim and shoe relative to the bones of the lower leg. Here's how to locate the bone just above the hoof capsule. At the coronary band, you can palpate and feel the coronary gaps, which are related to the bony column. This is the closest place to the trim where the bone can be located. These points are absolutely the most distal bone reference you can hope to find without radiography, which explains our interest in them. Imagine drilling vertically down from the coronary gaps. This orthogonal projection marks 2 points on the sole. These 2 points can be used to guide your trimming and shoe placement. We talked about locating what we call the coronary gaps, but what are they? They are soft spots caused by underlying anatomy and are associated with the position of the P2 bone. They are also the closest bone-related reference points to where we will place the shoe. What anatomical features do the coronary gaps relate to? Let's take a look. On a cadaver leg, we palpated and marked the coronary gaps. We then dissected to see what these locations correspond to. They seem to be near the edge of the extensor tendon and in front of the termination of the lateral cartilage. Further, in this image we see that when the coffin joint is flexed, there are bony eminences near the distal end of P2 that protrude forward. As the joint flexes, these bony eminences push toward the coronary band. There must be some anatomical space for these to move into, and these are the soft regions that can be palpated and that we call the coronary gaps. As you can imagine, if you can find them, they give you a bone reference that is as close to the capsule as possible. In some hooves, particularly those with hoof wall distortions, it may be hard to palpate the coronary gaps. If they cannot be located, or just to double check, you can feel for the next best bone reference points, which are at bony eminences near the distal end of the long pastern bone. These can always be palpated. These points, here marked 3 on the distal end of the P1 bone, are interesting anatomically. They are where the collateral ligaments to the navicular bone attach to P1. Whether the coronary gaps were palpated, or the alternate points at the distal end of P1, you can still imagine drilling vertically down to project those points onto the sole. In most cases, the hoof does not grow out as a nice uniform geometric shape. There are at least 2 important factors: natural growth patterns and forces acting on the hoof. There are natural factors built into any given animal that influence how the hoof grows out. Similarly, human nails may grow out with strange twists, and it is not due to loading. The locations of the projected points, shown here as red dots on the sole, help you assess the twists and flares of the hoof you're working on. Here we see a pretty good hoof, but here we see a twisted hoof capsule. So in the face of hooves that flare or twist, try to palpate the coronary gaps and in your mind's eye project them down onto the sole. This visualization may very well help you with some tricky cases. Imagine a severely twisted hoof capsule. This mental projection would make it very clear what you're up against when you visualize where the projected points are on the sole. Even if you can't fix the hoof with your trim and shoe placement, at least you have a means to assess the situation and track it from one shoeing to another. If you don't visualize the bone column on the sole, you might trim and place a shoe like this. But if you visualize the bone mapping on the sole, like this, then it becomes clear that the hoof capsule is somewhat twisted relative to the bone, And with these points visualized, you might place the shoe more like this. You would try to orient the shoe a bit differently, and you might try to rebuild a little bit of the missing hoof and trim the opposite flare. Again, here we've placed the shoe to the distortion, whereas here we've tried to shoe to the bony column. See the difference? You can't make changes all at once, but over time, you can help the foot. In summary, the bone reference trim is a method of palpation based on anatomy, in contrast to methods based on looking at the sole and/or shape of the hoof walls. There are many suggested reference points and external cues, for example, Duckett's dot, the widest part of the foot, 2/3, 1/3, etc. These have merits, but at the same time, any of these can be shown to have limits to their accuracy. While they may be useful on average, they are not necessarily reliable on a particular horse. Only by palpating the bones for an individual horse can you avoid a reliance on hoof capsule landmarks which are subject to distortion. Perhaps the most challenging part of the bone reference trim is making an accurate projection of the coronary gaps onto the sole. This is something that may take practice, but ultimately is worth the effort. Naturally, it's not possible to teach trimming in a 7-minute video. This overview is just meant as an introduction. That being said, try finding the bony column next time you trim. It can be a useful tool in assessing the state of the hoof and deciding how to trim and shoe.